Hi, I'm Lucy Zhao from the Wheatley School in Long Island, New York. Today, I'm going to give a quick overview on my project that attempted to find an effective treatment for neuroblastoma using two phytochemicals. Despite breakthroughs in clinical therapies in the past decades, cancer still remains the second leading cause of death, responsible for more than 10 million deaths per year. Neuroblastoma, a malignant pediatric tumor in the sympathetic nervous system, is the most common cancer in infants younger than 1 year. The survival rate for patients with high-risk neuroblastoma is about 40 to 50%. Usually, when a tumor migrates to distant parts of the body or metastasizes, the risk of the tumor becomes higher and the survival rate of the patient becomes lower. Unfortunately, more than 70% of neuroblastoma cases at diagnosis present some type of metastasis. At the present, the most predominant cancer treatment involves the use of radiation therapy and surgical removal of the tumor, followed by chemotherapy for maintenance. However, most chemotherapeutic agents have significant side effects on non-targeted tissues. Therefore, scientists are exploring the anti-cancer effects of naturally occurring compounds, which are generally less harmful to normal cells. The target chemicals of this study are curcumin and capsaicin, which are both chemicals extracted from the spices turmeric and peppers. They exhibit anti-cancer effects on prostate, lung, breast, and pancreatic cancer. However, no previous research have elucidated their effects on neuroblastoma metastasis. Therefore, in order to address this knowledge gap, the first part of my research found that curcumin and capsaicin were able to decrease the survival rate of neuroblastoma cells, disrupt their colony formation ability, and inhibit metastasis through a downregulation of MMP9, a protein that is capable of degrading the extracellular matrix. The effects are most pronounced at the combined treatment of 10 micromolar curcumin and 40 micromolar capsaicin, indicating their synergistic potential. After validating their anti-cancer effects on neuroblastoma cells, I wanted to see if they yield side effects on hypothalamic cells, which are cells in our brain that are crucial to maintaining the body's homeostasis. Recently, there has been increasing evidence of post-embryonic hypothalamic neurogenesis, which may play a crucial role in maintaining energy balance and feeding patterns. The absence of neurogenesis is also a hallmark in Parkinson's and Alzheimer's disease. In this study, the MTT cell viability assay showed that curcumin and capsaicin were able to decrease hypothalamic cell viability. Using zebrafish at 5 days post-fertilization as a model organism, curcumin was found to decrease the number of neurogenic cells, indicating that it can inhibit hypothalamic neurogenesis. The zebrafish used in my research also contained a transgenic line that expresses Notch-responsive cells. The Notch signaling pathway has been shown to regulate cellular differentiation in multiple vertebrates and sometimes even cancer cell proliferation. So in this study, curcumin was found to decrease the number of Notch-responsive cells. According to a study done in 2019, blocked Notch signaling can actually lead to a decrease of neurogenic cells in mice hippocampus. So if considered together with this study, it may suggest that curcumin is able to decrease Notch signaling, which will in turn eliminate curcumin's cell proliferation effects in the hypothalamus. So, the significance of this project are threefold. First, it identifies a novel combination between curcumin and capsaicin as a potential treatment for neuroblastoma. Second, it is one of the first studies to show that curcumin and capsaicin were able to decrease neuroblastoma metastasis, making them good candidates for treating high-risk tumors. Lastly, it also shows that curcumin can have some toxicity on hypothalamic neurogenesis, which contradicts with many previous literature that showed curcumin's lack of toxicity on normal cells. Therefore, through a comparative study on neuroblastoma and hypothalamic cells, this study evaluates the therapeutic potential of curcumin and capsaicin holistically through demonstrating their anti-tumor properties and their potential side effects, giving new directions to future research to further investigate the two chemicals' clinical usage.